Thank you, sir. Now we have Dr. Kaushik Murali, who will be talking on managing the social media.
So here we're sitting in a room discussing how to market, how to do social media, while most of us would probably think that we should rather be seeing patients. So once again, I thank KSOS for this invitation to be a part of this IC. Dr. Srikanth and Dr. Radharamanan have kind of made it easy, setting the context for what marketing is and how important social media and the online presence is. So we need to understand that social media is an animal, and this is an animal we need to understand. All our patients invariably are using social media. It allows us to communicate one-on-one with them. It is extremely cost effective because you can actually target it rather than do a paint and spray approach where you're doing something in the city. It allows you not just to sell, but also to showcase activities, accomplishments. You can promote you can do promotional activities, you can attract colleagues that you may want to join your practice, and it allows you to showcase testimonials. On the flip side, there always is a risk that the database that you have can be shared, can be sold, everything is available. There can be a false narrative that can come out. Information that you want to be held close can get out, and it does take time. And today, with the social media coming in, again, patients are going to refer to it and land up. We've had patients ask questions on ChatGPT as to when their scleral buckle should be removed and sit and fight with our doctors. So, there is not far where this is going to become a routine practice for us. When you look at social media per se, it allows you to, one, attract new patients, it allows you to raise public awareness, and three, more importantly, it allows you as a communication channel to actually showcase what your brand is. And consistency in doing all of this becomes very, very important. All these three, irrespective of the size of your practice or whether you're starting off your career or you're way ahead of it, continues to hold good stead. When you look at social media platforms, there are a dime a dozen. These four probably would be the most relevant. To put it in context, Facebook is similar to having a notice board. So it allows you to inform about various sessions that you're having. You can have a Facebook live session where you can interact with various people. You can give updates about seasonal outbreaks that are happening in and around your community, or even something as simple as saying that the road to the hospital is blocked or there is some construction going on. Use a rear platform. Twitter, or what is now referred to as X, is more like your breaking news platform. It is great to post about newspaper articles and repost it into that. It is great to post about accomplishments that you may have, awards that you've won, or something, some VIP patient or some celebrity who's walked into your clinic. YouTube is again something that all of us access to. This is your own personal video network. You can upload whatever you want on it. You can humanize it to the extent, if you're somebody who has a passionate hobby, to sharing videos about surgical procedures, to patient testimonials, to whatever you think is relevant to patients or potential patients and would enhance your own reputation as an individual. The last platform, again, I don't see too many of us doctors use it, is LinkedIn. This is a peer-to-peer platform that connects professionals. It will connect you to professionals outside of the medical fraternity and will actually help you in building those networks. You can build your reputation as an expert in the particular domain by actually answering to certain topics that may be there, or posting on larger topics of interest that would be relevant to the community. The current trends that we've been leveraging as an institution and that will hold good is currently video sales, or video is what attracts people. The attention is going down. So anything that you can post as a short video, a reel, or something with an animation usually works very well. We have a lot of YouTube content that is on our Shankara Academy of Vision platform that has helped us build an audience of almost about 15,000 people who subscribe to it. And that allows us to engage with people who will join us for training programs and also become potential colleagues at a later stage. Chatbots are again something that works well. We have chatbots running on our Facebook page. This allows in at least getting the patient to drill down to a specific question and understanding what the patient is looking for, or the person logging onto the social media is looking for. We do social listening every 3 months where we look at what chatter and trends are there on all our social media handles. And we try and understand where we are doing well, where we are doing bad, where comments are being posted. Influencer marketing is something we've not done. But some of our colleagues are influencers in the field, and we try and get them to post on their own personal handles and share it with us. Personalization is possible because you can target messages based on the age group. So you don't want a glaucoma message going into a group that has young mothers. You would rather post something about, say, eye hygiene or how it's important to go back to school with vision and stuff like that. So you can actually target and message groups. VR, AR, we've not used much. We've used a few medias on our videos and interactive things on our Google page. That has helped us to some extent. Now, the common challenges that are there is all of us have to handle multiple segments. Most of our organization works in silos. The doctor will not share to the marketing. Marketing will have no clue what we as doctors do. Inbox becomes a challenge because it is landing on a common domain where not all of us have access to. It may get forgotten. Localizing content becomes very, very, very tricky because when you're translating content from English to the vernacular, often you can have certain mistakes that creep in. Finally, content is king. If you have to, there is a pressure to share constant content. And if you're sharing content that has not been created by you, it is very, very important to fact check. Because if it is wrong, then it becomes a challenge. Don't feel shy to highlight colleagues' accomplishments. That becomes very critical. Wherever you're sharing anything from the patient, make sure that you have their permission to actually share that. Google review, I think Shrikant sir did mention it. We aggressively try and capture it because patients will go online when they are unhappy, very rarely when they are happy. So you need to have multiple ways that you can actually gather it. My last slide is when you're looking at building your social media management, one, centralize it, make sure that you can post across platforms. What's on Facebook goes into Instagram and stuff like that. Create a calendar. Sir did share about various days that we can celebrate. It's important for you to build relationships into your community, so you have to customize and respond. Like he mentioned, if there is a flood happening, how are we using social media to actually leverage it? So we set up a collection center for the Kerala floods in a hospital in Bangalore, and that made us extremely popular in the community, as though we were there for the community at that time. All we did was open out our doors. We didn't have to spend 1 rupee. We were able to mobilize almost about 23 truckloads of relief. You can improve your brand reputation. Google review is something you can't wish away. You have to make sure that you're responding to messages that come in, and it is very important for us to measure what is happening. Just posting is not important. What is the engagement happening? What are the negative reviews? What are our peers in the community doing? And see how you can actually uncover actionable insights. My last slide. Stay secure. Make sure that anybody who leaves your organization does not have access to your credentials. Otherwise, you're going to have a lot of challenge. It's very important for us as professionals to stay neutral, avoid anything that has political, religious, or inflammatory annotation. What is personal, should not come out, should not reflect on our institution. Be on social media. It is not enough for you to outsource it to an entity. Each one of us has to be on those pages seeing what's happening, and you have to be professional. So I have very clear protocols about who can post, who can comment, and even if a competitor comments about something about us, be professional in your response. You don't have to make it nasty. So thank you again so much for this opportunity to share something about social media management.
Excellent talk, Dr. Kaushik.